Since 2009, efforts to have a manageable and productive population that enhances development have been underway. The Advanced Family Planning AFP program in Uganda, implemented by Reproductive Health Uganda (RHU) and partners in Population and Development Africa Region (PPDRO), has achieved enormous but significant wins in areas of policy, visibility, and budget. In 2010, the Ministry of Health accepted the alternative distribution channel system where civil society organizations accessed family planning services.
The president himself has walked the way for a long time, since 2012, where in London, in a conference, committed that the government of the Republic of Uganda will be supporting family planning project by a fund of $3.3, which has increased now to 6.9. I think he has walked the way. We need to join government committedly and consistently to support the program. I'm happy that in our endeavor, the youth are not left behind. They are represented and they're doing very good work to mobilize the fellow youth.
We want to appreciate His Excellency and the government of Uganda and his leadership for that support. My colleague Richard has just mentioned, in 2014, we hosted the first National Family Planning Conference. And amidst us was the Executive Director, the late Papatunde.
In June 2012, the budget allocation for family planning was improved from $3.3 million to $6.9 million. In 2012, again, government of Uganda still allowed clinicians to perform tubal litigation. Contraceptives in Uganda were defined as medicines thanks to a change in the Tax Act by the government of Uganda in 2013.
When you give these indicators like contraceptive prevalence rate having risen at 41%, you are scholars, you are people who understand and appreciate these things better, you go and dissect it in terms of rural and urban. You will still find our people in rural areas, in Lango, in Acholi, in Karamoja, maybe the appreciation is still low. Maybe Kampala and the urban areas are contributing a bigger portion of this 41%. So we still need to reach there. We have created a space and environment as government where we have many channels that we can use to communicate these messages. We have radios. We have now over 300 radio stations in Uganda. We have over 40 television channels. We have many print media platforms. They have increased.
But earlier on, in 2012, the Uganda Revenue Authority waived off taxes on contraceptives. This was after deliberate and smart approaches to advocacy by the AFP in Uganda. Still in 2013, the Parliament of Uganda passed the National Population Council Bill.
Getting decision makers to invest in family planning. We want family planning services to reach out to the women, to the girls who need them, and we've been doing this advocacy for the last 13 years. We've engaged at national level, we've engaged at subnational level in the districts, and we've had a number of achievements. We've seen policies changing, government putting in place policy legislations that have improved the family planning environment, both at national level and at district level. And we've seen government increasing funding to family planning, especially commodities, but also family planning services. And that's the reason we are here to celebrate.
The government scaled up family planning programming by launching the Cost Implementation Plan and making investments from 2015 to 2020.
We have a population policy, and our policy says Ugandans should have access to information and services so that couples and partners should be able to produce children by choice not by chance. That's what the policy says. In other words, we must enable Uganda, the couples, the partners out there, to have sufficient information and tools to enable them determine the number of children they want to have, how to space them, so that it's by choice, not by chance. Not for them to exhaust their biological potential. That I have married my wife, we shall produce children until God stops them. Now we are saying, no, this couple, this family should be able to sit and discuss and say, yes, we are now man and wife. How many children should we have? How do we space them? Because we have to educate them, we have to give them health care, we must clothe them, they need shelter and so forth. So as district leaders now, how often do you do it?
In 2015, the Ugandan government signed the Alternative Distribution Strategy for Family Planning. In 2017, this was the year of improved and easier access to financial planning services. The National Drug Authority authorized the stocking of injectable contraceptives in private drug shops. In 2021, for the first time, the Ugandan government passed the National Health Insurance Scheme Bill. This was realized after concerted efforts to promote and demystify the myths surrounding family planning in Uganda, but also efforts to fund and promote it. With all this done, the unmet need for family planning stands at 40% in Uganda, with an annual population growth rate of 3.2. The modern contraceptive prevalency rate for all women needs to increase from 30.4% in 2020 to 39.6% by 2025, and reduce the unmet need from 17% in 2020 to 15% in 2025. As we celebrate this International for Reproductive Health Uganda, for Advanced Family Planning, for Reproductive Health Uganda, I'm Aldon Walukamba.